Okay, good afternoon, everyone. Hello, my name is Hugo Rodriguez, and I am a member of the Levy Senior Center Foundation, and we're happy to welcome you to today's Levy Longevity Program on maintaining health and wellness during the cold and flu season, presented by Dr. Salman Khalil-Uddin. This longevity series is presented in conjunction with Heallth and the City of Evanston. In these sessions, common issues of concern for adults 55 and over will be discussed so we can learn ways to live well and age gracefully. As always, we appreciate your support of the foundation as we continue to work to connect our community of older adults. I'd like to now turn things over to our wonderful moderator and partner in organizing these programs from AMITA, Samantha Cochran. Sam?
Thank you, Hugo. My name is Sam Cochran, and I'm an athletic trainer by trade and the sports medicine liaison in the Chicago metro region with AMITA Health. I'm going to start off by going over some housekeeping items. First of all attendees are muted for the duration of the presentation. Questions may be submitted using the Q&A feature in the bottom center of your screen. Please do not use the raise hand or chat feature or attempt to unmute. We will not be able to hear or see you. Questions will be answered at the end of the presentation during the Q&A portion. Additionally, it is not permitted for this presentation to be recorded by attendees. However, it is being recorded and will be available on the Levy Foundation YouTube channel and website. Lastly, this presentation is intended for information purposes only and is not intended to replace individualized care by your respective doctors or practitioners. AMITA Health and the Levy Foundation are not liable for the misuse or any information presented today. Now I would like to introduce you to our speaker. Today we have Dr. Salman Khalil-Uddin with us. Dr. Khalil-Uddin is affectionately known as Dr. K in his practice. He's a family medicine physician with AMITA Health. He employs an evidence-based approach to medicine and focuses on overall health and wellness of the person and not just disease. Dr. Khalil-Uddin, I now turn it over to you.
Hello, can you guys hear me? Okay. All right, welcome. Thank you for that introduction. Let's get started here. Okay, here we go. So our topic for today is preparing for the cold and flu season. And just a little bit about me. As Sam had mentioned, I work with AMITA at the Peterson location here in the West Ridge neighborhood. I am board certified in family medicine and osteopathic manipulative treatment, which essentially is a type of manual medicine that we employ. And we also try to take a holistic approach to medicine in general. I received my bachelor's in biology with a minor in chemistry at Loyola University of Chicago, right here on the north side. And I went to the Chicago College of Osteopathic Medicine at Midwestern University in Downers Grove. I did my residency training in family medicine at Beaumont Hospital System in the Metro Detroit area. So that's just a little bit about me. And then, so onto the topic itself. So these are common questions. Why is the winter season or, any cold temperature season, late fall, early spring, why is it the cold and flu season? And some common questions can arise, such as, can you catch a cold when you get exposed to cold temperatures? You might have heard the old adage that, when you go outside, don't catch a cold because it's cold outside. So we're going to discuss these topics, but just wanted to, give some food for thought at the beginning of the presentation. So since we're discussing the immune system, we need to define what it is. So what is the immune system? The definition is, it's a complex network of cells, tissues, organs, and substances that allow the body to fight infections and other diseases. So the key words here are complex network. So just not a set of cells or tissues, but it's an entire network, a interaction between different parts of the body and of the tissues and organs. And with that, we need to understand that if we approach the immune system through a holistic manner, we can better understand it because it's not one-dimensional, it's multidimensional. So one of the key words that I want to focus on today, and you'll hear this a lot throughout the presentation, is the word inflammation. So what is inflammation? Inflammation is a natural process that the immune system uses to fight infections and heal the body. It can be as simple as a release of certain cells or certain cell mediators, to be technical, that allow the body to heal. But there is a big caveat here. If it is prolonged, or once it started because of an infection, for example, and it cannot be fully turned off due to some malfunction, it can lead to different diseases. It can be harmful. And a wide range of chronic diseases can occur, such as heart disease, cancer, autoimmune diseases, such as rheumatoid arthritis, lupus, and a whole set of other diseases. So inflammation is good in a way when it's short term, but it can be absolutely detrimental if it is chronic. All right. Now, the immune system, studies show that the immune system starts to weaken with age. Now, at what age? It depends on the person, but generally speaking, it occurs around age 60 to 70 is when the immune system starts to kind of not be as potent as it was before. So what happens when the immune system weakens? Essentially, the person becomes more susceptible to infections, but also to cancer as well. So we see that in the older age groups, we do see a higher incidence of cancer, and that's because, in part, it's due to the immune system not being as potent as it was before. And this is an interesting point. Point number 2 there. As a result, any vaccines that we give, they become less effective because the way that a vaccine works is by having the immune system uptake that particular component of the vaccine and integrate it into the immune system. So if the immune system is not working on all cylinders, so to speak, or functioning as it should, the vaccine effectiveness will also decrease as a result. But I mean, one thing to really, not forget is that even though the vaccine may not work optimally, as in younger ages, they still do work. It's better than nothing. And towards the end of the presentation, we'll talk about vaccines, but I just wanted to kind of put this out there just so that everyone understands that the immune system does start to weaken. Now, the question should be, okay, if it weakens, well, that's not a good thing. So what should we do? Well, that's what this presentation is about. So what are ways to boost the immune system? The number one way actually is health. And by health, I mean diet, exercise, and nowadays we've seen a lot of studies that are focusing on mental health. So diet, exercise, mental health being, very strong in those areas, or having good habits in those areas really does help the immune system. And we'll go through an example of each. Vitamins and supplements do help in certain cases with helping the immune system out, and we'll go into that as well. And then environmental hygiene, such as washing hands, for example, wearing masks, that also does help. And then obviously vaccines. So this is kind of like the outline for today. And then at the end of the presentation, we'll also have time for a question and answer. So this is one disclaimer. I know Sam had already mentioned this, but certain things that I'm going to speak about, please speak with your physician before implementing any diet or exercise program that I mentioned, or any use of supplements or vaccines in general. Because for certain individuals, the following suggestions may not be appropriate. Generally speaking, they're obviously safe and effective, but for certain people, it may not be appropriate. So after having, your physician will know that if it's appropriate or not, if once a doctor understands the medical history and gets to know the patient, then it's easy to kind of make the decision whether it is appropriate or not. Okay, so the number one thing that can help the immune system is a healthy lifestyle. Now, you might be wondering, hey, this is supposed to be about preventing the cold and the flu and whatnot. Why is healthy lifestyle? Because a lot of scientific studies show that it is extremely helpful. And so we'll get into that a little bit later. But what I want to emphasize in this slide is that it's never too late to begin. It's never too late to begin. no matter what your age is, whether you're 55, whether you're 65, whether you're 90, whether you're even 100 or even older. It's never too late to begin. And I'll give you some very, very salient examples later on. And obviously the benefits are tremendous. It's going to help the immune system, and we'll kind of get into some very interesting studies that were done and the benefits of a healthy lifestyle. And yes, it does take some effort, but the effort is worth it. And you'll see that soon. But I want to kind of also have a little riddle, so to speak, to kind of get our brain juices flowing. So this riddle is about a paradigm shift. Okay, paradigm shift meaning that, the way that we approach things. So I'll go ahead and I'll read each line. So here's a riddle. I am your constant companion. I am your greatest helper or heaviest burden. I will push you onward or drag you down to failure. I am completely at your command. Half of the things you do, you might as well turn over to me and I will do them quickly and correctly. I am easily managed. You must be firm with me. Show me exactly how you want something done, and after a few lessons, I will do it automatically. I am the servant of great people and alas of all failures as well. Those who are great, I have made great. Those who are failures, I have made failures. I am not a machine, though I work with the precision of a machine, plus the intelligence of a person. You may run me for profit or run me for ruin. It makes no difference to me. Take me, train me, be firm with me, and I will place the world at your feet. Be easy with me, and I will destroy you. Who am I? Who was, if I was there in person, then, we can get some answers. But I will go ahead and go on to the next slide. The answer is I am habit. So habits really make or break us, and this can occur at any age. And specifically, the habits that I want to focus on are on a healthy lifestyle. So with one of the components of a healthy lifestyle is diet. It's probably the easiest factor to control, but it takes willpower. And so one thing that I, mentioned to patients and even to like family members and friends is to kind of trick yourself into a good habit. By trick, I mean, for example, we sometimes trick ourselves into eating unhealthy or eating junk food. I think we've all been there. We're not supposed to eat a certain food because whether the doctor told us not to, or we know that it's unhealthy. For example, you already had a slice of cake, but you want a second slice of cake. And you're like, well, you kind of justified and say, well, you know what, after this second slice of cake or whatnot, I will make sure that I exercise an extra 10 minutes tomorrow. So in that way, you kind of, in a way, quote unquote, trick yourself. Well, you can use that same tactic for good. You can actually trick yourself into eating healthy and exercising. For example, you can say, well, I may not like, X, Y, and Z, healthy food, or I may not want to exercise because I just don't feel like it, or I feel a little lazy today. But you can kind of begin to do it and kind of ease yourself into it, and then, give yourself a reward later on. And in that manner, you end up building a habit. And as we just, learned from the riddle, that the habit, a good habit, is extremely powerful. So think about that when we're discussing some of these good habits that we can implement. Now, in terms of diet, what's a general principle that we should follow? A general principle is that food should be natural and unprocessed. Okay, the more natural and unprocessed and what's the word I'm looking for? That a person doesn't mess around with it too much. The more natural and raw it is, in most cases, not in all cases, but in most cases, it is that much more healthy. So one quick rule of thumb is if you can find this food growing in a forest or a jungle, that's ideal. For example, if you go into a forest or a jungle, you might see pumpkins, right? Or you might see berries, or you might see certain fruits. You will see grains. So these types of foods that are naturally present in our environment and whatnot, those foods are extremely, extremely powerful and extremely healthy. Now, there is one caveat, and as we had made the disclaimer before, that, certain medications so a diet of natural and unprocessed foods may not be completely appropriate when it comes to some natural foods like spinach and broccoli, if you're taking warfarin or Coumadin or certain blood thinners, or even certain other medications. So, obviously before you implement a diet change, speak with your doctor. But the principle is natural and unprocessed is good. Now, eating more whole plant foods, such as fruits, vegetables, nuts, seeds, legumes, these types of foods have a lot of antioxidants. Antioxidants are certain chemicals and substances actually that are in foods that decrease inflammation. So speaking of decreasing inflammation, as we mentioned, inflammation before is what causes the immune system to heal or fight infection. But when it's chronically turned on, it may lead to chronic disease. So when you're eating whole plant foods, you can actually decrease inflammation inside your body from certain chronic diseases, which will make those diseases better. Now, one of the important parts of the diet is to focus on probiotics and prebiotics. And these two substances are extremely important in our GI health. And so gut health is very important. And recent studies have shown, this is recent in terms of probably the last 10, 15 years, maybe 20 years, we've seen that there's a lot of immune cells, immune system, parts of the immune system in our GI tract. And that makes sense. I mean, the food that we eat, it gets ingested, it can make us sick, or, it can make us healthy. So the immune system is there's a lot of the immune system in our GI tract. Therefore, substances such as prebiotics and probiotics will help enhance that immune system effect. So whole plant foods, they provide fiber, which is a prebiotic. And prebiotics, what are prebiotics? Prebiotics, they help feed the good bacteria in the GI tract. Certain types of fiber that are found in oats, berries, asparagus, garlic, onions, these actually help feed good bacteria and actually help prevent bad bacteria from growing. Now, the next thing is probiotics. What are probiotics? Probiotics are actually live bacteria, and they're important in balancing your gut flora, your community of gut bacteria. And so probiotics, which are live bacteria, they eat or they take nutrients from prebiotics and other substances in the GI tract. So probiotics are important, and they help balance your GI tract, and therefore they're very important in your immune health. And so where can you find probiotics? Well, you can find them in plain yogurt with live cultures, which are pretty much found anywhere on any shelf. But you can also try fermented foods such as kefir, which you can get dairy kefir or you can get non-dairy kefir. And it goes under a fermentation process. Or you can have other fermented foods such as sauerkraut or kimchi. But one thing about fermented foods, specifically sauerkraut and kimchi, is it's not for patients with high blood pressure, because one of the ways that they preserve they start the fermentation process is with salt. So it has a lot of high salt content. So if you have high blood pressure or if you have heart failure, that may not be appropriate. But these foods are very helpful in your immune health, and specifically your GI health. So as I mentioned before, your gut needs both prebiotics and probiotics to maintain a healthy gut flora, which is the community of good bacteria in your gut. A healthy gut flora improves your immunity by preventing unwanted germs crossing into the body from the GI tract. Other things that you can do is to eat more healthy fats, such as omega-3s and olive oil. These fats that are healthy are very potent at decreasing inflammation. And thus, if you decrease inflammation, you're actually boosting your immunity. Omega-3 fatty acids can be found in chia seeds, and in fish like salmon or cod or tuna. And I think now the general public, all of us, we kind of have appreciation for this. You'll see a lot of food labels advertise that they have omega-3 fatty acids. So the omega-3s you can get from plant sources like chia, as well as fish, in case you're vegetarian or vegan. Another great source, believe it or not, is extra virgin olive oil. And it has, doesn't necessarily have omega-3s, but it is it has different types of other healthy fats called short chain fatty acids. And they're very potent with against inflammation. Curiously enough, they are a mainstay of the Mediterranean diet, and the Mediterranean diet is well known for its many health benefits, and I'm sure you've all heard of it. And one of the health benefits that it has, or many of the health benefits, is cancer prevention. People who are on the Mediterranean diet, usually from the countries of Greece and along those areas in the Mediterranean coastline, they tend to have less cancer. They tend to have less stroke and heart attacks. They tend to live longer. They tend not to have dementia, and they don't really have diabetes, and they tend to be at a more normal weight. And so extra virgin olive oil is extremely helpful in the Mediterranean diet, and specifically in decreasing inflammation. Now, we talked about some foods to take. There's some foods to avoid. What are some foods to avoid? So number one is obviously limiting sugar. So sugar is huge when it comes to causing inflammation. You know, excess sugar intake leads to inflammation, leads to weight gain, which can worsen chronic diseases. Too much sugar can cause diabetes, which is obviously a very dangerous disease. For many reasons. One of the reasons is because diabetes suppresses the immune system. The sugar can also lead to obesity, extra empty calories. So obviously, I think a lot of us know this, limited sugar intake. I know Halloween is around the corner, but we have to be careful about this. So what is a recommended amount of sugar to take? Added sugar, artificial sugar, or not natural sugar, let's put it that way. It's about 25 grams of sugar a day, which comes to about 2 tablespoons. So, someone is drinking fruit juices or, soda, for example, or even putting sugar in your coffee and tea, depending on how much you're putting, you have to keep it less than 25 grams of sugar a day in order for it to be within the healthy range. Ideally, no sugar would be best. No added sugar. Also, we should limit processed foods. The preservatives in processed foods and other ingredients with those preservatives can wreak havoc on the immune system with prolonged use or long-term use or frequent use. Examples of processed foods are what we would consider as junk food, chips, cheeses, candy, all sorts of stuff that kind of, go into the junk food category. And this, this also does cause inflammation as well. Another thing to do is to limit caffeine intake because too much caffeine can suppress the immune system. So I know a lot of us, we drink coffee or tea, specifically in the morning time to, kind of begin the day, but we should try to limit to 1 to 2 cups per day. And obviously, even that may be too much if you have high blood pressure. So obviously check with your doctor. But absolutely try to avoid any energy drinks. Energy drinks are extremely harmful. You can have, if you really have a craving, you can have some caffeinated sodas, but make sure it's less than 25 grams of sugar that you're getting in one day at least. And now they have like 4-ounce cans, and they have smaller serving sizes now because of the high sugar content. But I know energy drinks are present, and you could probably buy them. Don't get necessarily fooled by the fact that you'll get more energy. What that essentially means is that the energy is coming from, quote unquote, energy is coming from the caffeine. So it revs up your body in a unhealthy manner, and you feel like you have energy, but actually it's not a healthy way to go about boosting your energy. Another thing is to limit alcohol use. Okay. So drinking more than one alcoholic drink per day is not healthy. I know some people, they would like, they want to unwind at the end of the day with a glass of wine or whatnot. One alcoholic drink is okay, specifically red wine, according to scientific studies, but doing more than that is not healthy. And depending on the person, then that might be a slippery slope. So, if a person tends to drink more alcohol, you might want to stay away from that because, one glass can turn into two, can turn into three. And depending on a person's mood, if they're not, if they're stressed out or if they're feeling sad, they may drink more than one. This, I would, exercise caution with this, but person doesn't have a problem with that. One alcoholic drink per day is absolutely fine, according to recent scientific studies. Now, one other thing is that if a person does drink alcohol, specifically in the wintertime, it does dehydrate the body. So, you have to be careful that if you are drinking alcohol, make sure that you're drinking a little extra water, because it will dehydrate the body. And when you dehydrate the body, you allow viruses to flourish. And speaking of dehydration, you want to keep yourself hydrated, right? So hydration is extremely important. You've probably heard the doctor say this before, and other health professionals, that staying hydrated is extremely important, especially when you're sick. But staying hydrated is important, but for different people, it may be, it may be a different level of hydration. Specifically, if you have heart failure or if you're on hemodialysis, then you have to be very cautious of how much water you're actually taking in. But if a person is, ill, drinking lots of water helps the body function optimally. And how much should you drink? Well, on a regular basis, if you don't have any contraindications, meaning if you don't have any medical reasons not to be drinking less water than normal, you should drink about 1 to 2 liters of plain water. So that may seem like a lot, but if you portion that out throughout the day, it's not that much. It's like like a regular size water bottle. You can probably drink about 3 or 4 of those a day, and you can get to about easily 2 liters. Some people don't like the taste of water. I've had patients tell me, "Hey, doc, I don't like the taste of water. I don't like plain water." And so some people have that, which is fine. You can get around that, but you still need water, but you can get around that flavor issue by maybe soaking fruits and vegetables in water overnight, like an orange slice or cucumbers or berries. There's different medley of fruits that you can use. Or you can even try flavor packets, such as Crystal Light or some of these other flavor packets. They usually don't have, from my understanding, you should still check the label, but from my understanding, they don't have much sugar in them. So they're essentially just a little flavoring type of substance. And so you get a little bit of maybe like a lemonade type of flavor to water. It doesn't actually change the water content or the property of the water, and you still keep the healthy property of the water while having some taste as well. So that could be tried if you're really not into plain water taste. Now, the next thing is that I want to talk about is, excuse me, is supplements. Now, having a illness is taxing on the body, and that can drain some of the stores of vitamins and minerals that are present in the body, and certain energy sources that are naturally there. But having a healthy diet, as we just mentioned, and exercising, which we'll mention later, can really completely, well, not completely, but it can mitigate those problems. However, another way to kind of get around this issue is to have supplements. Now, there's something called micronutrient malnutrition, and this means that certain essential vitamins and minerals the person is deficient in. And what ends up happening is that in certain groups, specifically the elderly, they tend to eat less. Patients, the older they get, they tend to eat less, have less of an appetite, and they have a less variety of foods. So this, what ends up happening is that this causes a deficiency in certain vitamins and minerals, even though the person is eating to what they feel is normal. So to get around this and to kind of go about replenishing your vitamin sources, you can supplement, which we'll get into a little bit later, but you can also color code your days. So what do I mean by that? Color coding your day means that you take a different color of a fruit and a vegetable, and you do that every single day. So you want to get different colors of fruits and vegetables because different colors of fruits and vegetables have different sets of vitamins and minerals. And scientific studies show that the color actually dictates or kind of gives a indication of what types and sets of minerals and vitamins are in that particular vegetable or fruit. So for example, a yellow fruit like a banana would have a certain set of vitamins and minerals that are different than a blue fruit, such as a blueberry. And they actually found that even within a color category, for example, if you have a yellow fruit and you have a yellow vegetable, the vitamins and minerals will be different from a yellow fruit versus a yellow vegetable. So ideally, you want to get a different color fruit and a different color vegetable every day. So in a week, for example, you're getting 7 different colors, which means that you're getting 7 different fruits and you're getting 7 different vegetables. So that's what I mean by color coding. So for example, if today is Wednesday, you can say today is yellow color day. So yellow fruit, yellow vegetable. Tomorrow is Thursday, it'll be green color day. So green fruit, green vegetable. Friday, it's red color day. So red fruit, red vegetable. And a good way to kind of implement this is to maybe try a smoothie in the morning or as an afternoon snack. And in the smoothie, you can put in your different color of fruit or vegetable for that day, along with a core group of fruits and vegetables that you would normally use. For example, say that you have as your base for the smoothie, as your core fruits and vegetable for the smoothie, you want to use kale, spinach, you want to use bananas and apples, right? So these 3, for example. Then to that, every day you will add, based on the color of that day, you'll add a yellow fruit and a yellow vegetable. So you say that particular day it's yellow, so you'll add a little bit of a banana, maybe half a banana or a full banana, and maybe a little bit of squash, right? And you want to keep the fruits and vegetables raw if you can. You necessarily don't want to cook them. And then you want to blend that into a smoothie. You're just putting a small amount of the yellow fruit and the yellow vegetable, but when it's raw and it's unprocessed and you kind of just blend it only and you drink it, just like 1 glass, that'll get the proper nutrients into your body. And when you get 7 different colors and you're getting 7 different fruits, 7 different vegetables, that's 14 different fruits and vegetables you're getting. You're gonna be replenishing any vitamin and mineral deficiencies in your body in a natural way. So this is probably the best way to supplement any type of micronutrient malnutrition, as we mentioned. But there are also actual supplements that we're going to talk about next. So dietary supplements may help maintain a healthier immune system. Excuse me. Now, one thing I put in bold and underlined is no supplement has been shown to help prevent or treat COVID. Okay, so this is important to know. I know there's certain things that people might be posting on social media and whatnot, but you have to know that so far, no supplement has been shown to help prevent or treat COVID-19. But certain supplements may help the immune system in a general sense. So one of these is vitamin C. Now, according to a number of studies, they noted that the scientists noticed that when a person takes vitamin C, they help reduce the duration of colds by 8% in adults and 14% in children. So supplementing with vitamin C doesn't necessarily prevent the infection itself, But when the person is infected with some type of virus, like a cold virus, it does decrease the amount of days that they're sick. So 8% less of a duration. So that, you're talking maybe, instead of the cold lasting 5 days, it lasts 4.5 days for an adult, and likewise for children. So it does decrease the duration. Now, how much should you take for vitamin C? The dose is around 1,000 milligrams once you're sick. But I didn't put that on the slide here because you need to check with your doctor. Certain medications, vitamin C can interfere with. So before you supplement with the vitamin C pill, you want to be careful. Now, one thing is when you do I'm just going back to our previous slide about the smoothie and, doing a different color of fruit and vegetable a day. Many fruits and vegetables have vitamin C naturally present. So you can also get your vitamin C through a more natural source when you're doing the color coding of the day, so to speak. Another important vitamin and mineral is that you can supplement is zinc. Studies show that zinc more than 75 milligrams, like around 100 milligrams per day, once the person is symptomatic with an illness, can help reduce the duration of the cold by 33%. So which is really good. I mean, vitamin C, as you see over here, was only 8%, but here zinc is about 33%. Now, there's more studies that need to be done, but you can try this. This is relatively safe. Vitamin C was also relatively safe too, by the way, but zinc is can be bought over the counter by buying zinc lozenges. So you can try that once you get any type of symptom of a cold. You can start using the zinc lozenges for about like 3-4 days, maximum 5 days. Zinc, however, does not prevent infection as well, but it's something to have on hand. And then lastly, in terms of the supplements, vitamin D. Now, vitamin D improves your immune health, and it improves the defense against infections. This has been proven. However, understand that taking extra vitamin D when you're not deficient does not seem to provide any added benefit. So the one good thing about vitamin D is that you can have it checked by your doctor, by your physician, if you have a history of vitamin D deficiency. Now, I put down a history of vitamin D deficiency because recently what I've been seeing is insurance companies are not covering vitamin D labs for screening purposes. They used to a few years ago, but recently they have not been. So if you don't necessarily have a history of vitamin C deficiency and the doctor orders it, it may not be covered, but speak with your doctor. However, if you have a vitamin D deficiency history, then it will likely be covered. In any case, you can start with a low dose of over-the-counter vitamin D supplement, vitamin D3 supplement, about 1,000 to 2,000 international units daily. That's what IU stands for, international units. Daily, you can use that. You can have such a thing as vitamin D overdose. But if you're taking vitamin D at a lower dose of 2,000 units, it's very unlikely for you to get to a overdose of the vitamin D. You would need to reach about 100,000 IU daily in order for you to get to that. But in any case, it's something to consider and something to speak to your doctor about. And another thing that helps the immune system is not smoking. So smoking is for sure it's a fact. It's an undeniable poison in every sense of the word. It suppresses the immune system, leads to many other diseases and cancers. Now, if a person is smoking for whatever reason, even a modest cut, meaning even a slight decrease in the amount of smoking, actually helps the immune system. It's because we have less poison. When you have less poison, you're going to have a stronger immune system. So obviously, I mean, you've heard all your doctors say this: don't smoke, and we're going to say it again. Please don't smoke. And if you're smoking and you tried to quit, but you're still smoking for whatever reason, even cutting down a little bit, and you'll be surprised, even cutting down 1 cigarette per day, or even even taking a few less puffs can help. Okay, now the next thing is that in our approach to boosting our immune system is sleep. Now, sleep is very important. 1/3 of our lives we are sleeping essentially. So 8 hours a day, or more or less, we're sleeping. And sleep, not surprisingly, because we sleep so much, it does affect our immunity. Now, if we have low quality sleep or insufficient sleep, this is not good. And the reason is because when sleep is compromised, studies show that you get an increased chance of viral infections. So it's more likely that a person can become cold, can catch a cold. So how much sleep is recommended? 7 or more hours of sleep each night is recommended. And we should be, cognizant of practicing good sleep hygiene. And so what is sleep hygiene? Sleep hygiene is a certain set of behaviors that you can implement to allow your body to kind of ease into sleep. So the most important is to limit screen time for at least 1 hour before bedtime. Screen time, what I mean by screen time is any type of device. So a smartphone, cell phone, laptop, tablet, computer, like a desktop computer, anything that has a screen. And so these screens, they emit blue light, and it's a certain wavelength of light. And blue light disturbs our circadian rhythm. And the circadian rhythm is our body's natural sleep-wake cycle. So it has to do with a complex interaction of hormones in our brain that allows us to sleep and wake up consistently. Let's put it that way. So limit screen time for at least 1 hour before going to bed, and sleep in a completely dark room, or use a sleep mask in order that even any type of other ambient light can affect sleep. And another good thing is to obviously go to bed at the same time every night. So this is very important to get your body into a routine. And what actually helps sleep, interestingly, is exercising regularly. But I mean, one thing to note is that don't exercise right before you go to sleep, because then, your body is kind of, it's kind of revved up and it'll be hard to go to sleep. But you should exercise about sometime during the day, sometime during the morning is best. And we'll get into that a little bit later. But exercising on a consistent basis does help with your sleep, and sleep helps your immune system. And exercise. So as we just mentioned, exercise helps sleep. When you regularly exercise, you strengthen your immune system for a number of reasons. One is because we just mentioned it helps you sleep, and sleep helps your immune system. Another is because it increases blood flow. When you have increased blood flow, when you're exercising, you have increased oxygenation of your tissues. Your tissues get more oxygen. And it decreases inflammation as well. So it actually pulls out inflammatory substances from your body. And it also improves chronic diseases like diabetes and heart disease, because those diseases, chronic diseases, are mostly caused by inflammation. So when you decrease inflammation, you're going to decrease the effect or the severity of chronic diseases. Exercise allows also immune cells to regenerate. So when you exercise, you're allowing your bone marrow, you're allowing your white blood cells and the different types of white blood cells to regenerate and to work properly. And this is very interesting. Studies show that even a single session of moderate intensity exercise can boost vaccine effectiveness. So exercise helps to such a degree that even if you were to even do it once, just once, with moderate intensity, it can help your immune system to the point that it will actually allow a vaccine to work better, because the immune system works better, so it can integrate that vaccine into the immune system in a more optimal fashion. So what is moderate intensity exercise? Scientifically is defined as 50 to 70% of a person's maximum heart rate. What's a person's maximum heart rate? You can calculate this roughly by subtracting 220 from the person's age, and you get the heart rate. For example, if a person is 70 years old, then you subtract 220 from 70, you get 150. So 150 beats per minute would be the maximum heart rate for that individual who's 70 years old. And 50 to 70% of that 150 is anywhere from 75 to 105 beats per minute. That should be the goal heart rate. Now, one thing to note here is that if someone is on a beta blocker for blood pressure or for any other reason, such as metoprolol or propanolol or carvedilol, that medication actually does limit the heart rate, chemically speaking. So a person, no matter how hard they try, they cannot raise their heart rate if they're taking those medications. So that's one thing to understand. But it doesn't mean that a person shouldn't exercise. They just shouldn't monitor their heart rate when they exercise. And they should, if they're on those medications, they should speak to their doctor before starting an exercise program. And you don't have to do moderate intensity exercise. Even small amount of a daily light exercise can do wonders. There's scientific evidence that even standing up from a sitting position is extremely beneficial if it's done consistently. And when you exercise, one of the other benefits besides boosting your immunity is that you can prevent falls. Especially when you're walking on uneven surfaces, and especially in the wintertime if it's slippery outside for whatever reason. If you exercise, you help your body have better balance. When you have better balance, if you were to on accident or unknowingly walk on an uneven surface, you can better catch yourself, or on a slippery surface, you can better position yourself not to get hurt. So exercise obviously is extremely important in many, many reasons. One of the other things is that exercise improves your mental health. And this is very important to keeping your immune system healthy. So exercise helps sleep, and exercise also helps mental health. And interestingly, sleep also helps your mental health as well. So exercise in general, and specifically outdoor exercise and outdoor activities, improves a person's mood by relieving stress and anxiety. One good thing to do is to try to exercise outdoors if you can. So if you're trying to get exercise by walking a certain amount, try to do it outside if possible. I know we're heading into the late fall winter season now, but if you bundle up, if it's appropriate, if your doctor okays you, it's okay to go outside for a few minutes. And even if you don't actually exercise, just walking outside for a minute and coming right back in can help improve your mood. And if you haven't done that before, I would after getting your doctor's approval, I would suggest that strongly, to do that even just for a few seconds. Going outside really does help, especially in the wintertime when we're all stuck inside. So mental health itself has a huge effect on your immune system. So good mental health is vital to immune health. Okay, studies show that prolonged psychological stress, such as depression or anxiety or any other type of mental health stress, it promotes inflammation and it suppresses the immune system. So it actually causes a physical change in your body. And there's actually a really interesting disorder called broken heart syndrome. And what happens is that in this example, just to illustrate, how much mental health can affect a person physically. If a person's extremely sad or heartbroken, quote unquote heartbroken, actually in certain situations, it can cause, this is very rare, I should point out, but it can cause a certain type of heart malfunction to occur. And it's called broken heart syndrome. But in any case, the point being here is that good mental health is extremely important. So how will you attain that? You have to mitigate stress. You have to control stress. And the way that you control that, one of the ways that you control it is exercise and going outside. Other ways are mindfulness, meditation, breathing exercises, journaling, okay, writing, things down, writing your feelings down. And if all of these things will help, but if you feel like you're still stressed, you should see a licensed counselor or therapist and speak with your doctor about that as well. One easy thing out of these that you can do at any moment in time is a breathing exercise. It's very, very easy. You just take a deep breath in. If you want to do it with me, you can. Take a deep breath in and count to 3 inside your mind. So take a deep breath in, for example. We can do it together if you want. So you want to count 1, 2, 3, and then exhale fully. And if you do this, even doing it once helps. If you do it 3 times in a row, that helps. The more you do it, you feel more relaxed. When you feel more relaxed, you end up having less stress and anxiety. And that eventually leads to better mental health, and better mental health leads to a stronger immune system. Now we're going to go on to the section of environmental hygiene. Environmental hygiene, what I mean by this is, external type of hygiene that you would need when you're interacting with others or different environments. So let's not forget the basics of this. I think we're all well trained now. This is like month 20 of COVID or whatever month it is. But remember to wear a well-fitted mask when you're outside, specifically indoors at places other than your home. And do not be shy to quarantine and isolate when needed. So quarantining and isolation just isn't for COVID. It's for any type of viral infection or any type of contagious communicable disease. So quarantine means that you stay at home and just wait. If you possibly got exposed and you don't have any symptoms, this is very important, specifically if you're visiting somebody who's immunosuppressed or you yourself are immunosuppressed. And isolation means, medically speaking, that you may have symptoms and you may have a possible infection because you have symptoms. So if you do that, you prevent others from getting sick, and when you're quarantining and isolating, you also give your body a chance to kind of heal itself. If you're out and about, you're kind of stressing your body out physically as well. Another important thing is washing hands. Okay, this is important. It's one of the best strategies to avoid getting sick. Make sure that you're washing your hands thoroughly, especially, and a lot of people forget, around the fingernails and between the fingers and the backs of the hands. It should take at least 20 seconds to wash. One thing that you can do is to recite the happy birthday song 2 times, and that'll get you to 20 seconds usually. You want to use warm water and soap because it removes germs. And warm water and soap is superior to hand sanitizer. This is across the board scientifically proven. It's better than hand sanitizer. Hand sanitizer, you can use hand sanitizer, at least 70% alcohol hand sanitizer. The hand sanitizer kills the germs, but it does not remove them. Whereas when you wash with warm water and soap, you actually remove the germs. You want to obviously, do some basic hygiene, such as wash your hands after using the restroom and before and after eating. An important thing is that if you're using a lot of hand sanitizer, or if you're, wash your hands quite a bit, do not forget to moisturize your hands after hand washing. If your hands are dry, your skin is a barrier of protection for infection. So if you forget to moisturize your hands and you have dry skin, you can introduce infection more easily. And last but not least, please keep your hands away from your face. Very, very important. Try to, if you have a habit, try to be more conscious, especially in the season that we're entering. Another thing that a person can do is to sanitize surfaces. Okay, viruses, they survive on surfaces for a few seconds to even up to a few days. They can live longer on hard, non-porous surfaces such as metal, such as certain types of plastic, certain types of wood. So you want to be wary of high touch areas like doorknobs and handles. And you want to, sanitize those specific areas. Now, when you're sanitizing or disinfecting, you want to use the products appropriately. One thing to be cautious of is that the products may cause skin irritation and respiratory side effects, especially if a person has a history of eczema or asthma. They already have underlying skin condition, eczema, psoriasis, or they have asthma or COPD or something of that nature. These products can be potent, and it's recommended to wear a mask and gloves when cleaning, if you need to clean. Also, try to open your windows to allow for some ventilation if you can. This allows the scent and the strong odor to kind of leave, and that's what usually causes the side effects. Now, excuse me. Now, this is a question that we asked towards the beginning of the presentation. Will I catch a cold if it is cold outside? The answer is scientifically not really. So why is winter cold and flu season? Because of two reasons. It's not necessarily the temperature, but rather the humidity. Because when it gets cold outside, you have low humidity, and that is a factor. And another thing is, because it's cold outside, indirectly it affects us because we're inside. So we're more likely to be indoors because it's so cold. So if you have more people indoors, you have more chance of coming in contact with a person who's sick. So what is humidity? Humidity is the amount of moisture in the air. Viruses tend to spread easier when there's low humidity. They kind of float in the dry air. If the air has adequate humidity, the respiratory droplets that the viruses usually travel in, they actually fall to the ground because they become heavy from the moisture. Conversely, though, high humidity, greater of 60% humidity, can lead to difficulty breathing or trigger an asthma attack. So you want to keep the humidity at a appropriate level. And you want to keep a humidity monitor at home. That would be recommended. And it usually comes with a digital thermometer. Either your thermostat at home has a humidity monitor too, or you can buy a thermometer, a digital thermometer, for a room that actually has a humidity monitor with it. The goal humidity should be around 50%, especially in the wintertime. You can go down as low as 35% up to high as 60%. When you're above 60%, especially if you have respiratory conditions, it can make those conditions flare up. Low humidity also causes dry nasal passages. So your nose becomes dry. And this is a problem because when your nose is dry, the mucus there becomes dry and your body cannot clear the mucus. If it can't clear the mucus, usually the viruses, they enter the body through the mouth and the nose. And that, remember the previous slide, we said keep your hands away from your face. It's because they enter the mouth and the nose usually, and that's through your hands. So if those areas are dry, if you have a very dry mouth, if you have a very dry nose, and there's no natural mucus there, it allows the viruses to linger and they can thereby infect your body. And you can consider using saline irrigation like a neti pot or steam inhalation when needed. If you're congested or if you feel like your nasal or mouth is dry, your nasal passages are dry or your mouth is dry. If you're doing steam inhalation, please do not, I repeat this, please do not take the steam and put it on your lap, on your bed and try to inhale. I've had patients who burn themselves when they've done that. So if you need to do that, do it in a safe area, standing up, put a towel over your head, and then do the steam inhalation if needed. Another reason that winter is cold and flu season is because of poor ventilation. Since more people are indoors, usually indoor areas are poorly ventilated. And on top of that, windows are usually closed and the heat is usually running, and the heat causes the air to get dry, so you have low humidity, and then you don't have ventilation, and then you may have a sick person. All these different factors create a perfect storm for viruses to enter the body. You can consider using an air purifier. According to the EPA, air purifiers can help reduce airborne contaminants, which does include viruses, specifically in a confined space like your home. But they have to be used properly. You have to use them according to the instructions, the manufacturer instructions. Let's see here. Okay, yeah. So the air purifiers, there's different ones out there that you can buy. Many of them do have a EPA label on them, so you can check that as well. If you, and now one thing to note here is that if you were to open your windows for a little bit, maybe like 5 minutes, that would be equally or more effective than using an air purifier. So just wanted to, throw that out there. But yes, air purifiers are good, especially at nighttime. For example, when you're asleep, that might be something that you may want to consider, along with keeping an eye on the humidity. Okay, now on to vaccines. This is the last part of the presentation. I know I'm about a minute over right now. So vaccines are recommended. This is extremely important in maintaining health and your immune system strong. First thing is, without further ado, is the flu vaccine. I mean, this is a season of the flu. You want to make sure that you're already vaccinated. If you haven't already done so, please get vaccinated. Usually the flu vaccine comes out in late August, early September, and offices usually have it by October. So it's very important, especially for anyone above the age of 65. 60% of all hospitalizations for flu hospitalizations occur in people age 65 and older. This is according to the CDC. Some people have some apprehensions about the flu vaccine. Understand that no flu vaccine has ever caused mortality, meaning no flu vaccine has ever killed a person, but the flu virus itself is notorious and is dangerous and has unfortunately killed many people. Another vaccine to consider is the pneumococcal vaccine. This is recommended for adults at age 65 and older, and adults younger than 65 with chronic diseases such as diabetes, asthma, COPD. There's two types of pneumococcal vaccines. Both are recommended. If as a person ages, pneumonia can become prevalent, or a person can be at higher risk for pneumonia rather. And pneumonia as a person gets older can be dangerous. So it's important to get the pneumonia vaccine. Next, the tetanus, diphtheria, pertussis vaccine, or Tdap as it's known. The pertussis part of it is whooping cough, protects against that. It's recommended once every 10 years. Whooping cough is very common in the wintertime, especially in younger children. So if you're, visiting grandchildren, you need to make sure that you're adequately vaccinated against this particular set of diseases. Diphtheria is a disease that's not very common in this part of the world anymore, but that is also a upper respiratory infection. And tetanus is a disease where you can, if you get pricked by some type of foreign object, like a rusty nail or whatnot, it can cause a bacterial infection. But what's very pertinent is the pertussis part of this vaccine. Shingles vaccine is also very important. Shingles obviously is a very painful disease. It presents as a rash. Shingles may spread via direct contact with the rash or even through the air. So this is very important if you're around younger children who have not gotten their varicella vaccine, the chickenpox vaccine, because that's the same virus. The chickenpox virus causes the shingles virus as well. Causes the shingles disease. You should be careful about being around pregnant women because of the fetus. So this is an important vaccine to get. And also, even though this is not directly related to the winter, person ends up getting shingles, the vaccine, the disease actually ends up diverting the strength of the immune system to take care of this shingles outbreak, and that allows for other infections to kind of come in and take advantage of that situation. So, if you're fully vaccinated, your immune system is ready to go. It's not being, quote unquote, distracted with another illness. Okay, now on to COVID vaccines. This is the last part of the presentation. So COVID vaccines, current data show for all three that are approved in the US, Pfizer, Moderna, and Johnson & Johnson. They continue to be highly effective since they were rolled out. They have been known to reduce risk of severe disease, hospitalization, and death, and they're still effective, pretty effective against the more contagious Delta variant that is widely spreading now. Right now, it's the best way to protect yourself against COVID. When you get the COVID vaccine, it reduces the spread of the virus, and very importantly, it helps prevent new variants from emerging. This is important because if we want to really, stop this pandemic, we can't have the new variants popping up. And one way to help in that is to get vaccinated. Now, Pfizer and Moderna are now approved by the FDA for a booster shot, which means a third dose. The third dose will be 6 months after the second dose, and they've been approved for the following individuals: anyone 65 years and older, anyone above the age of 18 who live in long-term care settings, which are defined as nursing homes or senior housing or adult day programs, anyone above the age of 18 who have underlying medical conditions such as diabetes, cancer, obesity, and a whole host of other chronic diseases. And anyone who's age 18 and or older who work in high-risk settings such as healthcare or education, essentially anybody who's a essential worker. Earlier this month, the FDA authorized the Johnson & Johnson COVID-19 booster shot. So anyone who's gotten the first, or initially it was only one shot, anyone who's gotten the first COVID J&J shot can now get the second booster dose at least 2 months after the first dose. That now the option has opened up for a new mix and match strategy, which essentially means that instead of you taking a second dose of the J&J, if you got J&J as a first dose, instead of taking a second J&J dose, you can take a Pfizer or a Moderna dose instead. The recent study showed that 2 doses of the J&J vaccine, 2 months apart, had 94% efficacy. This is after that second booster dose, which puts it on par with Pfizer and Moderna. Initially, when J&J came out, it was something around 60 to 70% efficacy. And this is the last slide here. As always, please consult your physician with even seemingly trivial medical decisions, because your physician knows your medical history and can appropriately give advice based on your personal situation. These are just general principles. And thank you.
Thank you for all of that information. We do have a few questions submitted. So I'll start off with the first one. It's going back to diet and talking about artificial sweeteners. Are any of them really natural or good for us, or should we actually just avoid them entirely?
So that's a really good question. Artificial sweeteners, initially, there were certain ones that were shown in certain studies to be detrimental to one's health, but it wasn't conclusively proven. I think the marketers or the companies, they've just removed them out of an abundance of caution. Certain ones like NutraSweet and Splenda nowadays, they're okay when used in moderation, but they are still they still are not without effect. So artificial sweeteners can be used in moderation, but yes, it is better to avoid them if you can, because they can still cause, if too much use of it can still cause issues.
Okay, that's great information. And then now on to sleeping. There's been some research and study that sleeping pills are not the best and can have some really negative effects. How do you feel about CBD or cannabis in order to help with sleep?
Right, so CBD or cannabis, one thing to note is that Yeah, sleeping pills can, just to kind of get to that point first, sleeping pills can be quote unquote bad, but maybe okay with short-term use, depends on, what your doctor thinks. Cannabis, on the other hand, studies show that it is somewhat of what we call a psychoactive substance, which means that it does tend to alter your the way that your brain functions, and can lead to, it's been associated rather with schizophrenia. There's no direct cause that it leads to schizophrenia, but it's been associated with it and can alter your mind. CBD, without the cannabis portion of it, or without the active marijuana components of it, the jury is still out on that. I can tell you, so CBD, I don't have a comment on that. Cannabis, I would say no. Sleeping pills, depends on your doctor.
Great. And now moving on to more supplements. Is there a way to identify supplements that might be more effective and absorbable for the body versus ones that it can't process?
So supplements in general. So one thing I didn't put in the slide, but I should bring up now, is supplements are not FDA regulated. So there's no real way to kind of tell if, for example, if you buy a vitamin C tablet and it says 100 milligrams of vitamin C, you don't really know if there's 100 milligrams of vitamin C. There may be no vitamin C in there. It may just be a sugar tablet. You have no idea. And you may think you got better because of a placebo effect. But so that's one thing to note, number one. Number two, and this is why I recommend natural foods and kind of making that fruit smoothie, so to speak, because oranges have vitamin C in them. But in any case, just giving that as an example. But certain supplements do require cofactors. For example, iron requires vitamin C in order for it to get absorbed. So this is a whole science in and of itself called nutrition science. To easily identify, for a general person, which ones can be effective versus what can't, is really hard to kind of make that judgment. You would need a trained professional to kind of help you guide you on that. But essentially, going back to the basics, if you just eat more fruits and vegetables, different colors of fruits and vegetables, if it's okay with your doctor, then that would be the best route. I know that didn't really answer the question directly, but essentially that's a very complex answer.
Thank you. So now this is going back to alleviating stress. You had mentioned mindfulness. Can you talk more about that concept?
So mindfulness is very prevalent in the wellness programs and wellness circles. Mindfulness essentially means that you are aware of your surroundings and that you're in the present. So you're not worried about the past, nor are you worried about the future. So you're just present right now in the present, and you're just thankful for what's around you. So right now, I'm very thankful that everyone's listening. I'm very thankful that there's this opportunity to kind of, discuss these important issues. And when you just think about where you are right now, that really helps center you. So that's in very, kind of a short abbreviated form of an answer for that. But there's many concepts to mindfulness, which is another topic in and of itself.
Thank you. Going back to diet again, is there a resource or can you list the 7 colors for each day of the week that someone should focus on?
Sure. So 7 colors, this depends on your, on your color choice, but you can do, for example, yellow, you can do blue, you can do green, you can do red, you can do orange, that's 5. Excuse me. You can do different shades in between those colors. As sometimes you can do purple or like a different shade of blue. You can do different hybrids. So 5 colors I came up with. There's probably 6 or 7. It doesn't have to be like an actual like solid color. It could just be like a shade of the color. For example, you can different types of apples, right? So you have different shades of apples. So you can use like a red apple one day, you can use a green apple the other day. So it's just the shade and the color is what really matters, and the variety. Big thing is that when people age, they tend to be very picky eaters. So to get past that, if you have variety, and if you can't get to 7 colors, that's okay. If you get to 5, 6, that's fine. But the point is the variety.
Awesome. And then now again, back to supplements. Is there any important difference between vitamin D or vitamin D3?
So so there's 2 types of vitamin D, vitamin D2 and D3. D2 is usually taken once a week, what your doctor will prescribe. If you have a low vitamin D level. Vitamin D3 you can take every day. So in the presentation, I said, I just left it as vitamin D, but for the daily 1,000 to 2,000 international units, that should be vitamin D3. You can't even find vitamin D2 as 1,000 to 2,000 units to be taken daily. So that usually won't be a concern.
Awesome. And now on to vaccines. How often should someone get the pneumonia vaccine?
So the pneumonia vaccine there should be 2 doses of it. You should get the first dose at age 65 and the second dose 5 years later at age 70. However, a person can get the pneumonia vaccine earlier than age 65 if they have chronic diseases. So if they have diabetes, asthma, COPD, certain other diseases, heart disease, for example, they can get it at age 40 or 35 or something. If they get it at that age, then they have to wait until age 65 for their second dose. So for example, if you were diagnosed with diabetes at age 50 and the doctor said, hey, take the pneumonia vaccine. So you got it at age 50, your second dose won't be until age 65. This is according to current CDC recommendations.
Thank you. And then we have one last question. This one is more individual specific. Oh, we have a couple more questions coming through. That's okay.
No problem.
So this one, this individual suffers from leg pain and that wakes up at night, and she's seen providers and it's undiagnosed as what the cause is. Do you have any suggestion to alleviate the pain that would interrupt the sleep?
So there's actually quite a few possibilities for that. I mean, you would need to do certain types of blood tests. You can do a trial of medications. A consideration can be deficiency of certain vitamins and minerals that your doctor can test for. Can also be a condition called restless leg syndrome. It can be many different things, but essentially, I mean, given what the exam shows, given the medical history, and given the symptoms and when they occur and how they occur and how frequently, all these details, which usually are done at an office visit, then you can come up with a good plan on how to approach that. But on this type of seminar, I wouldn't be able to tell you directly, unfortunately.
Okay, and one more question, more about general health. At what age can you stop getting colonoscopies?
So colonoscopies, you start getting at age 50. You can even get it sooner than that if there's some family history. However, you can get colonoscopies up until whatever age that you feel is appropriate. That's a discussion between you and your doctor. That's the actual answer. But routinely, though, they usually stop around age 85. So meaning that at age 75, if your colonoscopy is normal, Most doctors will stop around age 85, but that's not to say that you can't get a colonoscopy at age 85. And that's also not to say that your colonoscopy, you may need more colonoscopies before age 85. Just depends on what the colonoscopy results are. So it just depends on the situation and the scenario and the patient.
Well, thank you for all of that information today. That has concluded our Q&A section of this. Do you have anything else that you would like to add before we go?
No, I think I just want to thank everybody, and I hope that it was informative and helpful. Hopefully, we can all get through this winter in a safe manner and form some good habits.
Well, thank you everyone for attending today. I hope you found the presentation informative and helpful. Please be on the lookout for the follow-up email that will include a recap and information on additional resources, as well as a feedback survey. Thanks again, and we look forward to seeing you at the next Levy Longevity series presented by Heallth.